just because a client has capacity in secondary does not mean that they have capacity in primary. Are we okay with that? And the differentiation between the two will stop you going too far too fast. It'll stop you assuming that there's capacity when there's not. Now, that is not technically your fault. It's very, very easy. And that's what we've built this case study around tonight. Very, very easy, especially today. ChatGPT, the internet, the amount of sound bites that are out there, especially today. It's very easy for a well-meaning client who wants to inform themselves, who wants to psychoeducate themselves, to come to your room or come to your space. And I'm using the word masquerade, but masquerade's not fair on the client because the client's doing their best. But to mask as huge capacity for embodiments when they are not there. They have a willingness for sure, but their capacity is different. And your way of checking that, your first way of checking that, is understanding the differentiation between primary and secondary. We understand that primary is usually of the past. Primary is usually limbic in nature, that has all that limbic energy to it. It has usually the voice of the child's consciousness energy. It is usually a part of the experience of the originating trauma or trauma experience. It is usually the then. The secondary is usually the now, the very strong presentation in the now. Sometimes you will get clients who are presenting with primary pain in the now, because the primary pain has birthed and they are in the fullness of that primary pain, in this moment, in this now, even though they do not understand it. But hopefully you will be able to understand that because you see the differentiation. And that's our first assessment, the differentiation between primary and secondary. You have no idea how much this saves clients or saves therapists. We have the Safe Embodiment course. We teach this constantly. This is our first module in the Safe Embodiment course. And what we hear from practitioners time and time and time again is how this understanding has been able to let them slow down, has been able to let them not go at the client's pace of willingness, but to go at the client's pace of capacity. Because we are pulled by the client into their paradigm of willing. I want to get there. I'm in pain. I want to get to the root cause. I want to get to the parts. So when we understand this, we are saying you are client-led. Of course you're client-led, but you are client-led not at their own risk. You are not being pulled by their willingness. You're being directed by their capacity.